Hey guys, so excited to see you today. This is Guarav
And Bill Kortesis.
Today we're going to have an interesting episode where we're going to react to viral trends on social media and kind of what we think about them from an aesthetic standpoint.
This should be pretty interesting. I can't wait to see your facial expressions on some of these TikTok videos.
I want to hear some unfiltered comments.
Yeah, you're definitely going to get some from me. Welcome to HKB Uncut, the health, knowledge, and beauty podcast.
On this show, we unpack the newest techniques and trends in cosmetic surgery, how to tune out the social media noise to make empowered decisions about your appearance, and what you need to know before you book a procedure.
I'm Dr. Bill Kortesis.
And I'm Guarav Bharti. We are board-certified plastic surgeons and co-founders of HKB Cosmetic Surgery, an award-winning practice with 11 locations across 6 states.
In other words, when it comes to aesthetics and cosmetic surgery, we've pretty much seen it all, and we want to share our knowledge and unique approach to aesthetics and beauty with you. Whether you're interested in cosmetic surgery for yourself or want to separate fact from fiction in the plastic surgery world, we hope you'll tune in each week.
I'm a facial plastic surgeon. Let's get into it and break down what's exactly happening. So she has a bunch of sutures running all up and down her forehead and the sides of her face. And although it looks like it's these sutures that are creating the lift, that's not exactly what's going on. So it looks like she did have a brow lift, eyelid lift, and possibly a mid-face and maybe even a jowl lift. And the incisions for these are probably all in her hairline.
All right, so this lady looks crazy as can be. She's got these sutures all over her face, and you might look at that and be like, oh my God, what is going on? But the truth is that's actually a technique. It's called the A-net. It's a way to minimize any kind of collections of fluid in the face. A lot of surgeons are using it. We use it sometimes. I don't use it all the time. I don't think it's absolutely necessary, but it's not frowned upon. But what are they doing? Why are they doing that technique?
I mean, again, like you said, they're there to limit kind of fluid accumulation, because anytime you lift up any part of skin, your body's natural response to that is kind of fill up that space with fluid. And so they're just trying to avoid that and try to get things to stick or adhere exactly where they ended up putting it when doing the lifting procedure. I think it's a little excessive. You know, I think that many sutures it's a little too much for me.
There are a lot of rows of it, and like the vector of pull that patient had looked like she was pulled the shit out of. So anyway, I think the result's overdone. The technique of minimizing the space and that suturing on the outside is an interesting concept that I think has its place.
I probably wouldn't do it personally, myself.
Yeah, I would do it strategically. So a lot of our colleagues will do them strategically, like right here in the submental region, maybe 1 or 2 out here laterally. But, you know, one of our colleagues, Mike Nyack, always talks about the male facelift. I think in the male facelift, it might make real sense because the male facelift can have risks or issues such as high blood pressure, much higher risk for bleeding and hematoma. So by suturing all this down for 3 or 4 days and then taking it out.
But you have to take those sutures out.
Those sutures come out. That crazy look goes away. I don't know about that lady's lift. She was pulled like this, so I don't know if that changes. Yeah,
otherwise, you're going to leave track marks. So you have to take those sutures out early.
I mean, so, you know, all right, so this idea of mapping and showing on your face kind of what you're going to do for Botox and neuromodulators.
I think mapping's fine.
It's fine. It's all good.
I don't necessarily agree with Botox in yourself. Can you? Yeah. Have people done it before? Yeah. Is it like ideal?
I don't think so. I mean, more than anything, it's like, you know, your normal vantage point of doing this is going to be with you injecting, looking versus reflecting and looking in the mirror. So can it be done? Sure. Just because you can do something doesn't mean you should do something. So I'm not a fan of treating myself. I'd get you to do it, or get one of our amazing injectors. I don't know if I'd get you to do it.
She does what she wants, and she looks cool doing it.
All right, so injecting yourself with neuromodulator, Botox, or doing surgery on yourself, or, you know, doing a rhinoplasty on yourself, doing like, I mean, yeah, you could do it, but why would you?
No, not for me. Thumbs down.
I've been all about the DIY skincare lately. Today, I tried threads. If you haven't heard of them, they look like this. They're supposed to lift, build collagen, and tighten your skin. They will dissolve over time. I put them today in my smile lines. Well, a difference. I also put some here. I've got some acne scarring, hoping that these will go away. I'm gonna look lifted and snatched. Stay tuned for those updates.
So DIY threads at home.
That's a negative for me too. I just think they're
Where are you getting this shit from? What's it going to do in your skin? What are you going to do if there's an issue? And also, just again, the vector and how you do it. The vantage point isn't perfect. Like, you're better off just getting one of your colleagues to do it. Like, why are you doing it at home? What's the point? You're saving a couple bucks? I don't understand it.
the risk of infection is
Risk of
ultra
infections.
high.
Yeah.
And then, you know, if you put it too superficial, you can feel it, you can see it through your skin. Go to a trained professional.
Have a
let
trained
them do
professional
it.
do it. I mean, threads, and listen, I don't love threads. I don't hate threads, but I think they have their place. But like, get it done somewhere. Like, why are you going to do it at home? It just makes no sense.
Don't agree.
Threads are, materials that are essentially suture that's placed under the skin, that's barbed suture that has little hooks on it. So when you put it down under the skin and then you pull it back, because it has hooks on it, as you pull back, it'll hold. And so you can kind of get a little bit of traction from the threads.
But again, you got to think, what are those threads doing? It's actually lifting skin. And we know the skin has the least strength of everything in the face. And so that's not where you should get your lift from.
Right. And there's some threads that they talk about being a little biostimulatory, creating scar, etc. So maybe has its place, but I would say the thing that I worry about is, what are you getting? What are you going to put in there? Potential infection, potential complications. And then when you're doing it on yourself, is to make sure you have the right insertion, right point of vector. It's just a little harder to just do that. You don't have the visualization that you would have when you're doing it on, or somebody's doing it to you that's trained.
I would never do any of that.
Today's the day. I have decided I'm going to dissolve my lip filler. To be honest, I used a product that was a little too thick for my lips because I kind of wanted to go big. And I liked it for a little bit, but it has definitely migrated. The lovely trolls on here have informed me of it, and honestly, they're right. I have tons of migration, tons, and you can see in here as well. So anyway, I'm going to be dissolving with Liporays, and let's see how it goes. I'm going to be using this numbing cream. It is the most amazing numbing cream I've ever used. It does everything to where you cannot feel anything at all. So pain is stupid, and I will be numbing all around and inside my lips where I plan to inject the filler dissolver. So this is the product, and we're going to reconstitute it with saline. And I'm going to use 3 milliliters into one of these Liporays.
I really don't understand the concept of doing things to yourself at home.
I
Just
think the
go
biggest thing is,
play
like, do what you're kind of, you have to be extremely knowledgeable, because everything you do can have a potential consequence or a reaction or a problem. And I think just others, like when you're getting substances that aren't regulated by the FDA, the Food and Drug Administration, you're getting stuff that's shipped from outside the US. You just don't know what's actually in that product. I'd be just so careful about this. Like, the chances are, everything's fine, it works good, but like, I don't. Again, this, and the other concept is like the visualization. When you were treating yourself versus when I'm treating a patient or you, the visual, the dexterity that I have versus administrating to yourself and then doing it with a reflective source, unless you're doing that day in and day out, it doesn't make any sense to me.
What's the motive? what's the motive?
Save
for
a
these?
couple bucks. I don't know what the motive
Is it to get
viewership.
Is
Probably.
it viewership to get clicks and likes? I'm not sure. Go to a trained professional.
I mean, at the end of the day, this concept of filters is really interesting. It's great in some ways, but I kind of hate it in other ways because everything that you're seeing, it's this different reality. And, when you see this young lady put that filter on, it's a subtle change. Sometimes these filters really make them look give you this kind of cartoon or kind of really artificial, kind of brushed and look that all of a sudden we're thinking looks okay. We think it looks good. But let's be real here. If you really look at it, it doesn't look elegant or natural. It looks like this kind of almost this animated reality that we're allowing to happen.
Well, I'm afraid that patients are going to have unrealistic expectations of what the outcome is going to be with a particular type of procedure or intervention, right? In this particular case, they talked about filler. Filler's not going to give you a change like that. So those are the unrealistic expectations. I know you do it all the time. So if you had a patient come in having those expectations and you do it, that's going to lead to a very unhappy patient. So I think that's one of the main issues that I see with that stuff is like, hey, let's really talk about expectations.
And then the other is going to be, what is actually influencing us as a society, us as a people, us as providers on what is beautiful and aesthetic. There are things that we had historically. We had these kind of Roman canons. We followed these beautiful rules and these ratios and the golden ratio and all this stuff. And now that's all being distorted and being kind of essentially just manipulated through concepts of filters, etc., that can be really valuable in kind of seeing what a patient would want, but also in some weird perverse way creating this weird different kind of aesthetic narrative that is really not a natural, elegant, beautiful concept. And I think we need to just wake up a little bit. We have to kind of take control of this because this is the damned if you do, damned if you don't thing with AI. You have to get on the train, learn how to use it effectively, but you can't let it run with itself and then you follow it. And I think this is where we all have this gentle little balance. And I've been going down rabbit holes on this. We were having a long convo about this. If you don't adopt it, you don't use it in the right way, you're going to be left behind. But if you do too much and forget kind of what the core is of what you're actually doing, you no longer are making the decisions.
There's this podcast I was listening to was saying humans who use AI are going to far, advance humans who don't use AI. So we have to adopt it, right? Because it's going to be everywhere. And we have to understand kind of all the potentials that it has. But the downside is things like this, right?
Yeah. And it's happening all the time. All the time now, people are getting essentially fed or making decisions based on algorithms, based on what they're seeing, based on the screen time that they're getting exposed to. And I think it's a time where we really need to be cautious about. When you think about kids, that girl who was on there is a young kid, really young. And, we have young girls at home. They're all getting, things are getting framed up for them in this unique way. Even young kids who are watching YouTube all the time they're just getting framed up in different ways. So it's one of those things where we have to be really cautious. And I think us as providers can be that reality check and help, but we can use these tools effectively. So I think that it's probably a valuable thing for us to start thinking about what are things that we can do, using agents like Chrysalix and different things where you can have the right kind of simulation for patients to show whatever that filter effect is, but that's actually achievable. But I think it's a brave new world out there, and I don't love it. We were at that Hornets game, and they were doing AI on everybody. Not AI, they were doing filters on people, and I'm like, it's funny because you're doing stuff these filters were made to make people look silly and funny. And in some ways, you hear people being so crazy about putting labels on people and giving people names and et cetera, X, Y, and Z, and then they're basically converting someone into a weird looking animal. Well, that's not a right thing to do either. So I think I don't really like filters and things like that. I like people's natural elements, and if we can enhance or get them to a place that still represents them and refine them, let's do it.
The good news is, it is still primitive enough that you can sort of tell what's AI and what's not.
Yes.
The scary
for long.
part is not going to be for long, right? What's going to happen when you're like, oh, is that real or is that not real? And that's coming very fast. So be here tomorrow.
It's happening all the time. I think that's what all of us need to just remember. Think a little bit before we just jump on the AI band. We need to learn how to use it, but how to keep it under control. You know, this is interesting that there is some of these things for kind of the sensationalism in plastic surgery and getting, you know, multiple procedures and kind of how they get them and traveling for them, and you know, the idea of kind of the glory of having, you know, aesthetic surgery or just kind of taking on an extreme look. And you know, it's not something that we usually deal a lot with.
It's a weird flex,
Yeah.
right? And you know, you see a lot on social media. People kind of flex what they have, their cars, their houses, or shoe collections, you name it, jewelry. For what reason, I don't know. Maybe for followers and likes the same way. And now they're using plastic surgery for that same thing. It's like, you know,
Right.
it's this weird flex. And, you know,
And it is interesting, this idea of kind of the flex of saying, you know, I did this to kind of match my Instagram filter and the kind of the publicity got, because this just goes back to what we were talking about earlier. Like the filters are a real thing. Like people really aspire for that, and that kind of augmented sense of that artificial reality, what a filter can bring, and saying like, what can you do to achieve it? It's like this Netflix movie, The Uglies, that came out. That was literally about like when you get of age and you get your aesthetic surgical makeover, so that you can have this amazing, you know, utopian look, and you can join the utopian society. It's an interesting concept, and you know, the idea of traveling abroad, going to other places for that are surgery havens for a reduced price, like Turkey or Korea. I think that some of those places probably have remarkable surgeons, like incredible surgeons, ultra high volume. The only thing that sometimes you have is maybe potentially a little less oversight, potentially safety-related issues, potentially complication-related issues if you're far away. So I think everybody just got to do their homework.
Yeah.
You know, just be careful and think about what you're trying to achieve. Obviously, this guy wants a different outcome, a different look for different reasons. This is actually potentially how he actually generates his livelihood versus others. It's more of like a refining what you have and it being under the radar. So again, not everybody's the same.
would you operate on somebody who's had 30 or 40 plastic surgery procedures and continue wants to change the way they look?
You know,
Or
it's
is there something underlying there that
you know, there may be something underlying. Every once in a while, some of those patients can be their most remarkable patients because they need something fundamentally improved. So I wouldn't totally dismiss anybody, but I would my antenna would be up. I would be very cautious and make sure, because I just don't want to inherit a problem either. You know what I'm saying? But every once in a while, even a patient who's had a lot of surgery, we can make a dramatic impact on and help them, as long as the expectations are reasonable.
I would love to talk about the positives a little bit. I think one of the things, because I do a lot of breast surgery, is, you know, there's been certain individuals, celebrities that have gotten augmentations done. So I think it's normalized kind of the breast augmentation
Big time.
space. I think it's also talked about sizing and it's sort of allowed individuals to be comfortable with having plastic surgery because they're like, oh, you know what? It is okay. You know, everybody does get it and it's fine. If I do want to feel better about myself, I think it's okay and comfortable to have it done. So I think there's a lot of positives that go with that.
Yeah, I would say, you know, make the humanizing it, normalizing it a little bit, and just so that it doesn't have to be like in your face, or it doesn't have to be for the ultra wealthy, or it doesn't have to be for the stripper, or it doesn't have to be for whatever.
Yeah, it's for everybody,
It's
right?
for everybody. And like there's been other trends and things we're seeing now for kind of this super small volume, minimal recovery, like the Preserve technique, which has gained some traction also. The other is facial stuff, you know, people having facial intervention. So I think social media has been valuable in it. I think we're still learning how to play in that space. You know, one of the things that's hard in our space in social media is that a lot of times a lot of the algorithms are suppressing our before and afters. And the crazy thing is, and then you see the other things that are on social media, There's some very hypersexualized stuff on social media. There are things that'll come up that are just totally, in my opinion, I think inappropriate that you wouldn't want anybody to see, like children or people who are, unless you're like subscribed to some sort of internet, pay service, like an OnlyFans account. I'm serious. Like, we come on there, but our results, like the before and after for like a mommy makeover, or before and after for anything that shows any body skin, totally suppressed. And even like some of the TikTok algorithms will just be like, that's not good. And so it's hard because we want to show those results. And so I think for us now, more of it's patient stories and those patients sharing it. So I think hearing a patient's point of view on these social things is pretty, I think it's very powerful, because like people like to hear from patients. They like to see what's going on with them. So I think that's an interesting space and really valuable.
I think it's great. You bring up a good point about, I think social media is a good outlet for patients seeking great plastic surgery, right? They can actually go and figure out who their plastic surgeon is ahead of time. There's negatives to this too, by the way, but we'll get into that. But I think understanding who your plastic surgeon is, making sure you are good with their personality and who they are as an individual, you like their work, you get to know them ahead of time. I think that's huge, right?
The only thing is that, I know you're about to say it. If not, maybe you're thinking it, is that a lot of the people, we know so many people all over this country, and that some of those people that are on there that are like these mass found are somewhat ultra manufactured. I mean, they're just like, they've just focused on just manufacturing that social side. And it's like, what about the outcome side? What about the experience side? And so as you're doing your diligence, you have to also understand like the someone's digital representation doesn't necessarily correlate directly with actually what they're like in real life. And so this is the tension that we face here. And like, you and us, like we have tremendous following just organically. Patients just come. Luckily we have amazing patients, and so do the rest of our teammates. But to get the exposure and the outreach, you have to do things. You have to be out there, and you have to post stuff, and you have to be kind of doing things, and then try to get on algorithms, try to get likes, try to get comments. So it's a little bit of the wild, wild west from a standpoint of actually, does someone with 1 million followers, are they a better surgeon than someone who has 50,000? The answer is that's not not at all a correlation.
There's no correlation there.
And so, but it's just a provoking thought.
But I think having authenticity in who you are,
Yes,
is, to me, ultra important. I think I admire the plastic surgeons that are out there on social media, and what you see is what you get, and we know them in real life, and it's the same person. We're like, hey, be your authentic self, man.
so
Great.
good.
Or gal. Like I really value that. But it's the people that are two different people. You're like, oh, that's not your real self. You're just out there doing it for.
And I think for us,
clicks.
I think for us, it's really awesome when you can literally, if you are actually enriching the environment, the ecosystem out there, and providing high quality content and education, is really valuable, because like honestly, I learn from it.
And high quality care too, right? Because it helps individuals get what they want.
So the only reason why I ever was introduced to social, ever got on social, was because of this field and my work. And so otherwise, I think I would have probably been a very slow adopter, or been very, very quiet on it, just because I have my own personal kind of aversion to it. But we're in it, and it's
the world we live in.
It's the world we live in, and it has real value in it. And so we'll continue to play all over it. You obviously see there's a lot of pressure, and I think that, one thing that we always want is you want to be able to treat everybody and take care of everyone. And when cost becomes an issue and people start doing different things, for example, one of the things where people were getting silicone injected in their butts because it was cheap to go to a hotel and get it injected in them. Like, this literally is stuff that is toxic, that could kill them, that leads to horrible complications. That same exact kind of concept can happen if you just order stuff at home and treat yourself that is coming in, being imported from other countries. So I think people need to be really careful. We know cost is an issue, but like, there are other ways to achieve this and get this that are more cost friendly. There are different products now that are much more cost friendly than like, the highest of the highest brand that exists out there from like a neuromodulator standpoint. So I think patients can think about that.
And rewards programs, right?
Yeah.
So like, sign up for these reward programs that occur with these industry partners that we have, and they have really good rewards programs. And I think it's great. So like, I think there's ways to be cost conscious when figuring out. But I agree with you. I think sometimes you try to get a value and pay less, but ultimately you end up paying more because you got the wrong outcome.
Yeah, and if you had filler somewhere and it was no good, and it needs to be dissolved, like most of the time, any reputable provider is going to want to help you out because they want you to be happy. They don't want you to have, regrets, and it's their reputation online. If they're not willing to help and there's an issue, there's a problem with that provider. So I think people shouldn't be left with the bag, if they have a problem, to correct it themselves. That's not cool at all. I would be freaking out if my patient was trying to correct an issue that she had or he had with me or one of our providers. Like, we have to do that. That is not for them to do. I think one of the red flags to watch out for when people are researching treatments on social media, I would say one is like, too good to be true. I mean, like, just like ridiculous, like absolutely ridiculous transformations or something that just like is too good to be true. I mean, we've been on the road.
I think you do your research, right? I think that's so important. If somebody says something that you're like, oh my God, take this pill, you're going to magically lose 30 pounds and you're going to have ripped abs. Do your research on it. Go to a different site. Start, looking. Use ChatGPT to go down the road. Use one of these other AI agents on your phone to kind of analyze it and see if it makes sense or not. Because to your point, if it's too good to be true, it probably is.
Right, and if it's incongruent, meaning if you see like 4 people and then there's one that's like sticks out, like this doesn't fit or make any sense, but oh my God, it sounds so good, that typically indicates that there's something off there. And if there's like an injection or a treatment or a procedure that just is, you've never heard of, that only one thing is doing, you got to be careful of.
What are the most common ones you see? I think hair. It's like, take this pill and you're going to have a full head of hair. I mean, if I did, I would have had G's hair yesterday, by the way. So that one's a common one that I see.
That's a common one. I think other stuff, there's a lot of stuff out there for guys and hormone stuff all over the place about, stuff to kind of help you, be more of a dude and be better in bed. I think I just be careful with all those things and figuring out what's what, where is it coming from.
Or get taller, because that's happening.
Yeah, no, the taller ones, that's not happening. There's lots of stuff from a nutrition standpoint, tremendous things from a nutrition standpoint, and that I think I would just say, be careful, because like people are trying to make a sale, people are trying to get you to buy. All these things, they're engineered for you to buy.
Correct. And
so just make sure you're getting what you're going to actually utilize and consume. What about from an aesthetic side? What about these roller treatments that kind of ladies will get? What do you think about that?
I mean, you're causing some micro trauma, right? So the micro trauma does help, build some collagen in your skin. So I think it is beneficial.
I'm okay with that too. How about your girl, Kim Kardashian's post-op facelift garment?
Oh, it's a huge negative, right? I mean,
it's a zero. It's a zero, and this is what I mean by like it's all bullshit. So when you get on there and there's something like that, and people are buying it like crazy, it's literally
because you're spending money for nothing.
It's literally a facelift compression garment that is being sold for profit, and there's quite a bit of that hype. So when something doesn't make sense, or it's like, oh my God, that's so easy, why wouldn't I do that? Also think about who's behind it, who's endorsing it. I think those are things to think about. But listen, I bought all kinds of stuff too on that I see. There's a lot of stuff on sleep too. Tons of stuff for like sleep aids that are on there. Weird mushroom coffee stuff. I mean, there's all kinds of stuff out there.
Yep.
And it's just basically programmed for you to just buy it, or you have to delete or stop the ads. So once you go down the hole, it's coming back for you. And you're either going to bite on it or you're going to delete it.
Yeah, the algorithms.
Algorithms are smart.
I mean, I think there's a huge infatuation in our society with celebrities, right? They're always like, what are they doing? Mm-hmm. How are they looking so young? What can I do to look like them? So as you would imagine, it's a hot topic in plastic surgery world, right? And every plastic surgeon is jumping on it, have a video of them saying, okay, Brad Pitt did this, or, this person did this, or this person did this. Because again, they're ultimately looking for views, and then ultimately help trying to elicit that same response out of patients going, hey, prospective patients going, I want to look just like them.
Right. And, I think that I like it, but I hate it at the same time. I think sometimes when it's done in a way that like potentially erodes reputation, or like kind of like is like in an inflammatory way, I just don't like it. And you're like this too. I think we should build people up versus break them down. So I think as long as it's done in a positive light, but all these things are kind of they're sort of guessing. They're making educated guesses. And also some of these images, like I don't even understand. Like they'll show you a before and after. I'm like, all right, yeah, there's something that's been done, but also this image has been manipulated the shit out of. And so this is the problem, is that we don't ever have real before afters that we're talking about. We're talking about a picture that was taken at this time that was edited, another picture that's taken at this time that's edited that we're looking at, and you're talking about what's the difference. At the end of the day, I think it's good for conversation, but I don't ever want, I think about it, I think about my children. Like, I don't want them striving for somebody else's aesthetic ideal at all. Like, it's like, maybe you're looking for harmony, you're looking for balance, you're looking for restoration.
Yeah, you want to be the best version of yourself.
You don't want to be the best version of yourself.
You don't want to look like somebody else, and I think that's kind of a bad thing. And I think, to your point, trying to be positive, we have to understand these celebrities are real people.
Oh yeah, they're huge. They're real people.
And they're having real procedures for reasons we don't know.
Yeah.
And who are we to judge them for wanting to have that procedure done and to judge their appearance? I wouldn't want anybody to put my picture up there and judge me.
No.
And just because they're a celebrity, you know, this is their job.
Yeah.
Their job is to be in movies, or their job is to be, you know, on TV, or to be a, you know, a social media star. Who are we to judge who and what they are? So I'm anti it for that reason.
Yeah.
And so, but I think it does bring to light. I do like the celebrities who come out on their own and talk about their plastic surgery.
Right.
I'm all in favor of that because I think it's shedding good light into our specialty. But I'm reluctant to be that guy that's going to be out there saying this celebrity had this and this for different reasons. Because again, who am I to judge why they got something done or not? And I'm definitely not going to judge somebody else's appearance.
Yeah. You know, and it's tough. Like, I get it. It's what we do. It's our space. You know, this is literally what we do, and you can kind of point things out. Every once in a while, I will tell you when we do that, we're wrong too. So I think that it is what it is. I think it's fun to appreciate beauty, and but there are certain times, there's no doubt, when people overdo or do things in a way that don't look great, and they take on a distorted sense of self. And so it's unfortunate to see that, and I think we're seeing less and less of that. So it's good that that's happening. But at the end of the day, public kind of shaming, broadcasting, it kind of sucks. And so I think that we like it when people do it in more of a tasteful or more of a kind of under the radar fashion. I would say that TikTok, Instagram, YouTube have had a massive part in our way that our industry has behaved and will continue to behave. But you think about these things and how this idea of influence and aesthetic and trends have always been there, actually. People influence each other's behavior.
Yep.
Their sense of style influences others. Their way that they consider what's beautiful and aesthetic has always been there. There's always been pressures.
It's just a different platform now.
Different platform and different levels of kind of exposure and potentially there could be this way that you can kind of sort of create more of a actually homogenous look. I think that's the only thing I worry about is when you have these social things, you all of a sudden get broadcast. Everybody thinks this is how it's supposed to be, and it's like all the way out there. And that I feel like could potentially erode kind of the uniqueness that we all have.
Yeah, we have to be careful, as in with anything. Watch out for AI. Watch out for these filters. Watch out for unrealistic expectations. Do your research. You know, search for the right surgeon, right provider. You know, I think that's the good in social media.
And be you only when you want to do these images, but maybe a little better so that you just like what you see when you look at yourself, not necessarily striving for some other, you know, look that you think you're supposed to look like. All right, everybody, thanks for listening. Please be sure to like and subscribe. Check us out on our social channels and send us some messages of anything you want us to talk about or any questions you might have. Tune in next time.
Thank you. Thank you for listening to HKB Uncut. If you enjoyed this episode, please subscribe to us on Apple, Spotify, or YouTube.
To book a surgery consultation or med spa appointment with our team, visit our website at hkbsurgery.com or head to the links in our show notes.